Our children are getting more weighty. They are becoming obese because of the diet and lifestyles. You can imagine we would prefer high-calorie diet, and nowadays we prefer sitting in the house, watching telly as we eat. In other words, we are basically sedentary. We don't engage in a lot of physical activity. Nowadays, the border comes for you at the door, so you don't even walk. Yeah, and yet we are still eating the same volume. Diabetes is a condition where one has high blood sugar in his or her body. Fine, so broadly, those are the two major types of diabetes. That's type 1, where you are not producing enough insulin, and then type 2, where your body is not responding well to the insulin you are producing. There are other rare types. They are not very common, but I think for the general public, I think the two types are what we see commonly. One is either drinking a lot of water, feeling very thirsty, passing a lot of urine, and getting tired, Those tend to be across the board. It's just that the severity will vary in the two types. Type 1, there's a lot of what you think is the genetic aspect of it, as opposed to type 2. Yeah, so it's more related to that weight gain, okay? We are seeing more cases of obesity in adolescents, which is the recipe for type 2. If the symptoms continue for quite some time, the child will get what we call an acute complication, where the blood sugar is so high that the child starts developing symptoms related to very high sugar in the body that makes the body produce some toxins. And eventually they may lapse into coma, a condition we call ketoacidosis. Prolonged high sugar, poorly treated, you'll have issues with your heart, your blood vessels, your kidneys will fail, your nerves will be damaged, okay? Yeah, so those are the major areas that will be affected. Once you have that diagnosis, it's very important that you work with your doctor, okay, or health provider, who should be very conversant with managing diabetes, okay, so that you can be guided through your diet and your treatment to actually avoid getting complications early.